Hi, friends. It's me. I've missed you. I hope you're doing well. I'm going to ask you before we go any further to please bear with me. Watch until the end because I have some things to tell you. Over the last year, I've been posting all the times I've been sick or in the hospital. I have been very vague. I finally got some answers and I have had the time to process everything. I've talked with my family and my close friends, and now I get to share it with all of you. It's a lot, but it'll all tie together in the end. So, all of this started back in 2020. I developed really bad heartburn for the first time. In 2023, I was admitted to the hospital because I just felt very off. And that was when I had my first endoscopy. They put me under sedation, put a camera down my throat, and they found a pretty good sized peptic ulcer. The doctor is assuming that I developed the ulcer back in 2020. After that, I was put on prescribed medication for heartburn. We were just gonna wait and see if that worked, and it did not. On top of that, we started noticing that I was somehow losing all of the blood supply to my body every 3 to 4 months, and I would have to go in to get blood transfusions. A woman my age, their normal hemoglobin is usually like 10 to 14, I think. I could be wrong. But my hemoglobin was regularly dropping to a 3, 4, or 5. So it was pretty dangerous. In true Lizzie fashion, this was yet another mystery on top of everything else. It started becoming a pattern whenever I would have a flare up of ulcer problems and blood issues that I would go back to the emergency room and I refer to it as needing to refill my tank. That usually required an admission, and I'd stay a few days, get hooked up to everything, get all the medication I need, and then I'm good to go. A few months later, we ended up back in the hospital. I ended up having another endoscopy done. This time, we saw that the ulcer had gotten bigger. It was also bleeding. There was a very tiny cut, and that is where my blood was going. On New Year's Eve, my sister got engaged and we celebrated as a family. They came over that night and it was really, really nice and such a special moment. I knew I was having the signs of another ulcer flare up. I think we all knew that it was going to eventually be leading to yet another hospital admission, and yep, it happened. I was still focused on the flare up of the ulcer, but I remember I told the doctor about my ear bothering me. I see fluid. I think you just have adult swimmer's ear. In the summer of 2024, I felt like I needed to refill my tank yet again. So we go do our normal routine, go to the emergency room, they do the blood work, the doctor comes back in, and he informs me that things are very serious and I was in active liver failure. I don't know where that came from. That came out of left field. I went to see my primary care doctor. I was feeling good, but kept getting reminded that, I still can't really hear all that well from my right ear. So he sent me to an ENT and also to do a hearing test, which I failed. I go see the ENT and then he sends me for a CAT scan of just my right ear to get a better look because, as you can imagine, my ears are extremely tiny. At this point, we are in the fall of 2024. They're just supposed to be looking at my right ear, but they scanned my whole head. Got it done, flew to New Jersey with my dad because I was giving a keynote speech for Johnson & Johnson. The morning of my speech, I was getting ready and doing my hair and makeup. I see that the ENT is calling and I answer it, not really thinking anything because what's the worst that he can really say about my ear? He proceeded to tell me that they looked at my scans and they were shocked at what they saw. In the scan, he saw a very large tumor in my left sinus area. He saw a tumor behind my blind eye, and the middle bones in my ear have collapsed inward. While I'm hearing all of this, unexpected information, I am getting ready to go do a very important keynote speech. Luckily, my dad was with me, so I was able to talk it through with him. I knew I'm here and I have a job to do and I need to focus. Yes, this is huge, crazy news. Right now, I'm here and I need to do what I need to do. This is me telling my mom on the phone everything that the doctor just told me and then saying, okay, I gotta go speak. As they say, the show goes on. Yes, I just found out some super crazy things. I still got a job to do and I gotta go inspire some people. The speech was incredible. Just to give you a spoiler, not to worry, that part is okay for now. So now we are in 2025. I am back again in the hospital because of the ulcer, and it was to a point where I was begging any doctor that I saw to please just make the pain stop. The other thing that made everything a lot more difficult is my veins. As you can imagine, I often have to get IVs. You can see my veins and they look good, but they're very deceiving. I was sent home with a PICC line in my arm through talking with my doctors and the nurses to think about getting a port placed so that I wouldn't have to deal with the trauma of all of the failed IVs. I had the procedure in February to have my port placed. That part went perfectly, and it wasn't until I was in recovery when the nurses noticed that I was having trouble breathing. And it turned out that the doctor, because I'm so tiny, accidentally popped my right lung and it was completely collapsed. Being like a huge fan of ER the show, not in real life, ER the show, and also Grey's Anatomy and The Pit and everything I've seen when people have to get a chest tube. Now I am real life having to get one, and I felt the cut and the thing, I felt all of it, and I thought it was almost done, and then I hear the doctor say, I'm really sorry, it didn't work, we have to do it again. I was supposed to go in as an outpatient, ended up having to stay for 6 days because I needed a chest tube. I start feeling like myself again. This is what I've been dealing with. A ulcer that has been horrible since 2020, to then having a random ear infection, to then finding out that the bones in my ear collapsed, and also there's like tumors in my face. In that moment, when I went home from seeing my primary care doctor and getting a good report, I was happy. I'm standing in the kitchen and I'm taking a bite of a sausage biscuit. My dad is home, my brother's home. I take one bite and all of a sudden I feel a loose tooth and my heart sinks and I freeze and I look at my dad and he's like, what's wrong? He jumped up, walked towards me, opened my mouth, and three teeth fell out of my mouth. It was a bridge, so they were all attached to each other. My brother sort of held me up because I was bawling and freaking out. I was told I was going to need oral surgery. I spent the next few weeks on the phone all day, every day, with my insurance, with regular doctors, with specialists of specialists, because there are so many new characters coming into this story of mine that I needed to be organized with it. So I created a document that had all of my insurance information, had every single doctor that I was an established patient with, their phone number, their address, their hours they're open. I included every medication that I was at the time taking, the dose of it, how many times a day I was taking it, and all of my upcoming appointments. And I made this document for myself and for my parents. About a month or so after that, I went back in for yet another endoscopy to check on my little buddy, my little friend, my little peptic ulcer, who somehow, for some reason, decided to get even bigger and decided that it is going to be resistant to any type of medication. Now, I'm sure you're probably thinking, Lizzie, why don't you just ask them to take it out? Why can't they just perform a surgery and take out the ulcer? The type of surgery that I would need to have this ulcer removed, the survival rate wasn't that high. Oh, I forgot to add what else they found during that lovely endoscopy. They realized that I also have a hiatal hernia, so my stomach is being pushed up into my throat. Most ulcers don't last like more than a few months, and I have now had mine for 5 years. My quality of life has completely changed. I have missed so many things. Family trips, I have missed other people's birthdays. I have not been able to go a full day without terrible pain. It has been very isolating. I haven't been able to work or travel or do the normal things that I love. I just want my life back. I started seeing a new hematologist. This doctor has absolutely changed my life. He has gone above and beyond for me. Last time I was in the hospital, he went to see me, and I was very, very discouraged and disappointed because the one last medication did not work. And the thought of starting from the very beginning, trying to figure this out again, was just something that I did not want to process. This angel of a doctor came into my hospital room. I brought up the topic of the surgery. He said, I know a really, really great surgical oncologist that I want to talk to. The surgeon's office called me because they believed I was a good candidate for surgery to have the ulcer taken out. For what we knew, this was going to be a very, very risky decision. We needed to talk to my brother and sister, mostly because we usually make huge, huge decisions like this as a family. We invited them over for dinner and basically just wanted to let them know how serious things have gotten, the risks involved. There were tears shed, but we also laughed a lot, just like we always do. My number one thing is I wanted to make sure whatever I ended up doing, I am not having it done until after my sister's wedding, because she's getting married at the beginning of July. And I am not missing it. That night, I had texted my group of girlfriends that we've had since we were 13 and told them, basically just said I want to talk with them about a potential medical decision I will be making. Our plans left the group chat in a day, and we met the next night. They dropped everything that they were doing, and we met the very next night, and we were very impressed with ourselves that we were able to do that. I will say this. The support system I have had over the last year and a half, I could not be more grateful. From friends traveling, visiting me in the hospital, coming over just to hang out, to one of the times where I was at my lowest of lows and getting the sweetest surprise video messages from the actors of my absolute favorite show. Okay, if you're still watching, I know you're probably like, all right, we get it, hurry up, tell us what you gotta tell us. So here it is. The surgeon feels very confident. We will be removing the top part of my stomach, which also includes the ulcer, and he will also be pushing my stomach back down to where it belongs. I'm not gonna lie, I'm scared. I'm very, very scared. I know that everything is gonna work out in the end. It's gonna take a lot of time to heal. I'm in. I just want my life back. I am ready to not have pain and to be able to eat normally and to be able to travel and work and do things without getting sick. I'm scared, but I'm ready. So now that I have told you everything going on, I hope this makes sense as to why I've been so MIA. But now I can't wait to bring you along for the happy moments like my sister's wedding. And then at the end of the month, I will have my surgery and I will bring you along. I'm going to leave you with this. At this moment, I don't have a lot of fight in me. I'm not going to waste what energy I do have on things that I cannot control. That is where I'm going to put my focus. Everything else is big and loud and a lot and overwhelming, but if you're able to just focus on your strengths, your courage, put that towards improving yourself in any way, shape, or form, please do. I love you guys. I miss you. I'm happy we had this talk. I'm happy I told you everything. I love you. Thank you for your support. Bye!